Hello everyone, I am drberkkkaratas. I will talk about the confusion surrounding penis enlargement. Why did I feel the need to make this video? For this reason, especially on social media and other platforms, there's a lot of discourse about penis enlargement. There are some techniques. Even I heard the name for the first time. It's not medically recognized in the literature. There are some statements, for example, groom filler, like filler, especially like real penis enlargement. So the part to blame here is not the viewers. The part to blame is us. So me and my colleagues, let's wrap these up in some way. So some things, it's being announced, it's being advertised, but we shouldn't think of this like selling a product. Honestly, I don't think so. This is a medical procedure. So for example, I don't think penis enlargement should be a video title. It shouldn't be. If that's the case, then we are here doing the fake version while our colleagues who do this are doing the real thing. Or it seems like what they did before making that video was wrong. If our colleagues who do this make the real version, it seems like we are making a fake version here. Or it seems like what they did before making that video was wrong. So statements like this are not very accurate. We need to be very careful about these. So by changing the names of some things, I mean giving them new names and new technical terms, we have some scientific terms. But since we are very scientific here, we don't use them. These can be used, but when they put their own produced terms, that's when the trouble starts. We don't use them here because we are very scientific. These can be used, but when they put their own produced terms, that's when the trouble starts. So this is a problem for them too. Actually, everyone is shooting themselves in the foot. Because honestly, in the past, my patients used to come and ask me, I was saying that they have given it a name themselves, and I was saying some things to protect my colleague, but now I've realized that the situation is getting out of hand. I have to make an explanation. I explained for a while, then I said, why am I explaining things that someone else has made up? I wonder why I am explaining some things that he made up. Now I say that there's no such thing, and I just brush it off by saying, I don't know how they do it, but that's really not right. My colleagues who do this, what can I say? I just want them to be careful. That's all I want. There's no such thing as the best in this work. You have to do the best for every patient anyway. The best method is this method. Best method is that method. If this is the best method that has been proven medically, then you can just say its name. But when you say this is the best method for penis enlargement, that's not very accurate. That's not very accurate. We have to do the best for the patient, There's no such thing as doing the worst, the average, and then the best. This is also quite important. Please pay close attention to this. If it weren't for doctors sharing these kinds of techniques and videos, I wouldn't take it very seriously. What I'm saying is that I have a mind, I have an opinion. The guy's not a doctor or anything. I'm going to say, why did you go along with that? But when there are doctors on the other side, urologists and those involved in these matters, unfortunately, problems can arise. I hope they are a bit more careful with themselves. Now, in the matter of penis enlargement, you really need to pay attention to this concept. First of all, what do you want? So when we talk about penis enlargement, as you know, I covered this in a previous video. Lengthening and thickening are different processes. Doing both at the same time isn't always the right approach anyway. So if you want length, then focus on length. If you want thickness, then focus on thickness. You need to be a bit clear about this. I want to enlarge my penis. So sometimes 80% of the patients who come in with a size of 14 centimeters already fall within the normal range. But they want an increase of 2 centimeters, 3 centimeters, or 4 centimeters. There is already a limit when it comes to lengthening. Yes, there aren't many limits when it comes to thickening. Of course, we can make it 7 centimeters, 10 centimeters, and even 15 centimeters, but it would create a very bad appearance. But when it comes to length, we already have an automatic limit. So your penis that is 13 centimeters will not become 20 centimeters. The maximum your 13 centimeter penis can reach is 14 centimeters. 15 things are around 16 centimeters, meaning it's about 2-3 centimeters. No matter which method you use, also pay attention to this in the methods. According to me, okay, for example, I explained it in the previous video. It's about the silicone sleeve. Yes, when the silicone sleeve is put on, photos are shared, etc. The penis has grown, but which penis has grown? An erect penis. When it's erect, so what is the topic you want to discuss? Do you want a certain length and thickness in sexuality? Or is it not very important in terms of sexuality? Teacher, do you want it to be thick and long in its standing position? Which one do you want? This is quite important. If you're married, definitely consult your spouse. Or if you have a partner for a long time, definitely consult them. Yes, look, 90% of women already want it to be long, big from the start. This is clear. When they see a big penis for the first time, it excites them. But when it goes inside the vagina, what they actually want is pressure. What does pressure mean? It means thickness, because the vagina is an organ sensitive to pressure. So if you have a 40 centimeter penis, I've mentioned this in a previous video, there's really nowhere for it to go. I mean, there's a limit to how deep the vagina is, and half of your penis will be outside anyway. This isn't very important for women. The initial excitement from the first sight is important, like the wow factor, but during the actual relationship, it doesn't become that significant. They desire a lot of thickness and, of course, an appropriate size. It's not about the sexual personal aspect of the penis-vagina relationship. We've already written books and made statements about these. This is also quite important. Aside from that, please be very careful when deciding on penis enlargement. There are too many promotional statements, too many commercial messages. I mean, I've never done it until today. I only explain it in the videos. I'm also explaining to my patients. I tell patients that if the penis size is normal, no medical intervention needed. They shouldn't do anything and continue their lives. Of course, it's their choice. But of course, ultimately, the organ belongs to the individual. Our aim is to get what he wants without harming him, is to fulfill their wishes in a reasonable and sensible way. So that's what we're trying to do. While doing this, let's try not to harm yourself as much as possible. And most importantly, please know what you want. Let's work on it. And most importantly, please know what you want. If you know what you want, you can act accordingly. This is one of the most important topics. If you go to the doctor saying you want to enlarge it, the doctor might not provide you with length, but he can provide thickness, and you might not be happy with that. That's why you need to know what you want. Thank you.